Glaucoma, which I'm going to talk briefly about, is a common disease of the eye. It affects approximately 2% of the community and is very commonly runs in families. If you have a first order relative with glaucoma, you probably have about a 20% chance of developing the disease. Glaucoma is a disease of the optic nerve. It's often associated with a raised pressure in the eye, but not always. About 20% of people with glaucoma don't have a raised pressure at all. And this pressure is created by fluid which is made in this area here, which circulates through and egresses the eye through this area here. This area here is like a half a bicycle tube which runs around in the anterior chamber there, and in enlargement is shown here. And it filters the fluid out of our eye back into the general circulation. In chronic simple glaucoma, these pores do not work as well, and the pressure rises inside the eye usually, and gradually the increasing pressure causes the optic nerve at the back of the eye to become diseased and to atrophy. Unfortunately, glaucoma is not easy to diagnose. Optometrists classically take the pressure of everybody over 40 years of age, and they often refer patients with glaucoma. We then investigate them by doing visual fields, measuring their pressure, and doing other tests which we're going to show you briefly. It's a complex disease and sometimes requires some quite complex treatments. The commonest treatment that you'll have heard about is the use of eye drops, and there are many different kinds of eye drops to use for glaucoma. And some here along this shelf are some of the common ones which we use. This one particularly, Zalaten, is probably the commonest. We also use laser in the treatment of glaucoma. We use an instrument called selective laser to open the pores in this meshwork to allow the fluid to escape. Sometimes, much less commonly, we have to operate on patients with glaucoma, and we create a trapdoor on the surface of their eye to let the fluid out of their eye. This is not common. On our website, you'll find more information about glaucoma in a section labelled Captivate, where there are animations about glaucoma and the various risk factors which are involved. The commonest risk factor is being born into a family with glaucoma. There are other risk factors involved, such as being short-sighted, being long-sighted as well, or being of Afro-Asian descent. Also on our website you'll find a brochure, and on the brochure is further information about glaucoma and pictures of the sort of defect which occurs in vision as the disease progresses. Glaucoma is called the thief of sight, and it's a very apt name because glaucoma causes the vision to deteriorate, especially early, and for one to be blissfully unaware that it's even occurring. It's important that you're referred early, that you're diagnosed early, and you're treated early. There is no substitute for early treatment after early diagnosis.